Starting with the name of Allah, the most gracious and the most merciful. My name is Dr. Bilal, and I'm Assistant Professor in Forensic Medicine Department. Today we are going to discuss a very important topic, that is gastric lavage. Regarding the gastric lavage, we previously discussed in our lecture that it is a process by which we remove all the contents that are present inside the stomach. Specifically, we use it for the poisonous contents removals. An important thing about the gastric lavage is it must be done early within 30 minutes to 1 hour. All right. And what will be the process for that? We will be discussing whole in detail. What is gastric lavage? What are the different process for it? What are different components that are used in the gastric lavage? What are the complications of gastric lavage? Absolute and contraindications. All right. We will be discussing that. Do remember, we use the gastric lavage to remove unabsorbed poison from the body that is not absorbed yet, that is present inside the stomach. So main focus is to remove it as early as possible. So this is the gastric lavage procedure that has been performed. You guys can see it. There's a plunger over here, a big 100 cc needle. Along with that, there's a tube. So we're gonna discuss that, why we are using it. So gastric lavage is also commonly known as stomach wash. By this process, we are able to wash the stomach along with the gastric secretions. This is a process used to clean out all the stomach contents and used to eliminate the poison from the stomach. All right. So that is used to eliminate unabsorbed poison. We discussed the acute poisoning treatment and management. This was very specific step to remove the unabsorbed poisons, and unabsorbed poisons has been removed by the gastric lavage plus by inducing the vomiting. In the vomiting we discussed the most important one is apomorphine, which is given subcutaneous. What is the purpose of the gastric lavage? For the urgent removal of the ingested substance to decrease the systemic absorption, the most important one. Second is to empty the stomach before the endoscopic procedure. And third one is there is some gastric hemorrhage inside the stomach, and this hemorrhage is continuously producing the blood. So we need to arrest the hemorrhage performing the gastric lavage. What are the indication for the gastric lavage? With the patient that is ingested the poison, we cannot use it for inhaled poison. We cannot use it for poison that has been given IV. We can only use that is edible poisons has been eaten and present inside the stomach. That's very important point. Second is the indication the cleaning of stomach before the upper endoscopic procedures. Someone who has been performing the vomiting blood. For example, in the esophageal varices, there's a lot of engorgement of the blood vessels of the esophagus. So here, most of the time the bleeding occurs. So arrest this bleeding or find out the endoscopic cause for that, we need it to perform the gastric lavage. Collecting the stomach acid for test, for example, is a very popular test we call it H. pylori, or different other acidity tests has been performed. So we need to remove the acid from the stomach through the gastric lavage. And for example, there is a blockade in the intestine. The intestine has been blocked and we need to reveal that pressure by performing the gastric lavage. There are some indications for the gastric lavage. Do remember, it's a life-saving procedure. It must be done as soon as possible. As soon as possible. What are the contraindication? For the absolute contraindication is corrosive poisons. Corrosive poisons in the syncum we discussed, these are those poisons which are producing the corrosions, the ulcers. So in all of the corrosive poisons, the absolute contraindicated because it produces a lot of complications except in the carbolic acid. Most of the time it appears in the MCQs. Carbolic acid is the only acid where we are performing the gastric lavage. We're going for the relative contraindications. These are the strychnine poisoning. Strychnine poisoning, we can perform it, but it is a very nasty poison. It produces a lot of convulsions and a lot of hyper reactions. So for that, if any stimulus produced, it producing all the effects of convulsion again. So it's a very complicated process in that. As well as in the kerosene oil poisoning, it is relative contraindicated. What is the procedure for that? The procedure for that is the patient must be prone or semi-prone. That's the position. Hips must be higher than the head, face on the one side. And if the patient is having any artificial dentures or any artificial teeth, we must remove them because there are some chances for being swallowed inside the uh, uh, mouth. So mouth gag must be applied to prevent the gastric tube biting by the patients. This is the position in which it's left. There's a mouth gag has been applied. Now this is the nasogastric tube, and that's the plunger has been used. Now, what is a stomach tube or nasogastric tube? Stomach tube is a red colored tube. It's made of the rubber, flexible, and its inner diameter is 12 millimeter, and the length is 1.5 meters. So the length of that rubber is 1.5 meters. Most of the time appear in the MCQs. Very important. At the lower end of this tube, there are 3 to 6 opening. So this is the gastric lavage or stomach wash tube. It's almost 1.5 meter in length starting from here. It is the rubber and red color. It has a funnel, mouth gag at the opening at the uh, lower most opening. There's some holes, and that's the suction tube. There's a very old procedure nowadays that's not been used, but one must aware about it. That is a stomach wash tube. One must know the distance of the cardiac end of the stomach from that of the incisors or lips is this 45 centimeter. So within the 45 centimeter, you must consider your position of the gastric tube. First, we need to lubricate the lower end of the paraffin. That's very important to anesthetize that. Be careful that the lower end of the stomach and not in the lungs. How are we gonna check that the stomach tube is not in the lungs but in the stomach? Most important one, if the patient is conscious and the stomach tube is entering inside the lungs, so he will be producing a lot of choking effect and asphyxial effects. But if he is unconscious and you are performing such effect, so we gotta use the stethoscope. By the stethoscope, we're gonna put some the air inside the epigastric regions in the stomach through the nasogastric tube, and some bubbling effect will produce. If these bubbles has been heard by the stethoscope over the stomach, it's confirmed that it is inside the stomach. You must listen to the hissing sound that has been produced by the plungers that has been introduced the air inside. All right. After performing that, we need 200 to 250 ml of plain water at a normal temperature, and we need to repeat this procedure for 5 to 10 times, collecting all of the important things. And first two washing must be sent for the chemical analysis because it has a lot of high evidences. From which things we can perform the gastric lavage or stomach wash. All right, we can perform in the plain water. We needed some demulcents. Potassium permanganate is very important. Tannic acid, milk. We can also perform it with milk as well, and charcoal on top. In the small babies, this stomach tube is called uh, Hess's tube. All right, Hess's tube start from H, and its almost length is 20 centimeters, very small. 10 to 50 ml syringe has been used in the gastric lavage, and wear mask, rubber gloves for your own protection as well. So this is the Hess's tube has been used inside the small children's. It's very important for performing the gastric lavage. What complication can arise from the gastric lavage? First of all is aspiration pneumonia. Aspiration pneumonia is a condition where the unwanted material from the stomach has been going inside the lungs, producing the aspiration pneumonia. So this is a very important complication for the gastric lavage. Other is the laryngospasm. Whenever there's involuntary muscle contraction or spasm lead to the severe laryngeal muscles contractions. Hypoxia and hypercapnia, of course, there will be hypoxia, oxygen will less inside the body, and carbon dioxide will be a very, very greater amount due to the uh, uh, physiological dead space has been created, and lack of oxygen in the body tissues. Another complication. Along with that, we'll be facing some bradycardia, shortness of breath, and mechanical injuries might be present there if in the case of throat, esophagus, or stomach might be injured through the tube. Is there any question? Thank you so much. If there are questions, please do ask me. We'll be discussing next time what are the antidotes. That's enough.